In recent years, the concept of a rapid response has entered clinical practice. This is the idea of having careful attention to early warning signs of deterioration in a patient's condition, and then quickly escalating any concerns to a small dedicated team that can rapidly assess the patient's status, respond if needed, and then change the plan or site of care as indicated. And in high-risk situations, this has been shown to save lives, and so rapid response teams have become a standard. This year has felt like a rapid response for Children's Minnesota. From the onset of the coronavirus pandemic, we had early indicators of an impending crisis, and we took immediate action. We opened up the hospital's incident command system and took steps to ensure that we could continue to provide care safely and effectively. In just a few weeks, we developed and implemented protocols for coronavirus testing and treatment and PPE. We changed workflows and care models across the organization. We moved many of our people to remote work, and we expanded our telehealth by a factor of almost 100. We also implemented a number of very painful but necessary measures to reduce our expenses in the face of sharply reduced clinical activity and revenues. I've been amazed and gratified by the way Children's Minnesota, the way all of you have responded to this unprecedented challenge. And because of all of that, we are now much better positioned to weather the rest of this crisis and to start to turn our attention back to thinking about our future. Nobody has a crystal ball, but it's pretty clear that in the aftermath of COVID-19, there will be profound seismic changes in the healthcare industry. Now, some of these will come in the form of short to medium term headwinds. So for example, we fully expect that, as has happened at other times of deep economic disruption and uncertainty, we will see a decrease in the demand for some of our healthcare services. We will see a decline in birth rates and therefore fewer pediatric patients. We will see lower reimbursements and more of our patients depending on Medicaid. And this will last for some finite period of time. Other changes will be permanent. We'll see greater reliance on virtual means of care delivery. In fact, our patients and families will expect to engage with us differently, usually digitally, in all of their interactions with our system. The clinical and societal measures that we're taking to prevent the spread of COVID-19 and prepare for other emerging infections will change the incidence of many pediatric conditions and will change patients' and families' healthcare seeking behaviors. Costs of care will be even more important than ever before. And change, rapid change, will become the new normal, requiring ever greater flexibility and nimbleness from all of us. Now, as daunting as all that sounds, the good news is that our response to this year's events has shown that we are totally up for the task. If 2020 was a year to respond reactively to what was thrown at us, 2021 is the chance for us to start to redesign our system proactively to meet those challenges that we foresee in the future. Healthcare is not going back to the way it was, and neither are we. We have an obligation and an opportunity to change in ways that will better meet the new needs of patients and families. We have to evolve and do it quickly, and we will. And to do that, we will need to adopt some more streamlined approaches to planning and decision-making and strategy while staying true to our values of joining together and listening, really listening. I don't yet know what that redesign looks like. I do know that in the future, Children's Minnesota will look different than it did in the past, even while we honor the past. I know that as we enter the redesign, we will do it with the needs of patients and families guiding our decisions. I know that we will use this year to position ourselves for the future, redesigning in a way that makes Children's Minnesota clinically and financially sustainable so that we can continue to care for kids in this community and beyond for a long time to come. And I know that along the way, we will foster an environment that supports change, that enables and empowers all of us to be a part of that change, to be a part of building the Children's Minnesota of the future.